If you have Sjogren's and a history of allergies, eczema, asthma, or food sensitivities, this video is going to connect some of the dots for you that nobody else has probably connected. Hi, my name is Dr. Wada. I'm a quadruple board certified allergy immunology physician who also specializes in the place where allergies and autoimmunity collide. I live with Sjogren's myself. It took me years of training and personal experience to understand these connections, but I'm going to explain them to you in the next 10 minutes, and I promise that some of these are going to make you say, gosh, that explains so much. So let's dive in. Here's what frustrates me about how Sjogren's is typically taught in medical schools, and even in immunology and rheumatology training. It is presented as a disease about dryness, dry eyes, dry mouth, maybe some joint pain. Check the antibodies, prescribe artificial tears, move on to the next. But that is not the reality for most people living with this disease. The reality is complex, multi-system symptoms that don't neatly fit into the box or check the check boxes. Unexplained reactions to foods, temperature sensitivity, crushing fatigue, brain fog, burning skin, dizziness, and doctors keep telling you that's not Sjogren's, that must be something else. But what if it is Sjogren's? What if all of it's connected and we've just been looking at it wrong? That's what I want to explore with you today in 10 things about Sjogren's that most people, including many doctors, don't know. Number 1. Allergies and autoimmunity often share the same root problems. And here's what I mean. On the surface, allergies and autoimmune diseases look totally different, right? Allergies are where your immune system overreacts to harmless things like pollen or peanuts. Autoimmunity is when your immune system attacks your own tissues. But here's what they have in common. Immune system dysregulation. In both cases, your immune system has lost its ability to appropriately calibrate its response. It's reacting when it shouldn't, or it's reacting too strongly. And in both cases, we often see the same underlying contributing factors. Gut dysbiosis, so a disrupted balance of your microbiome. Barrier dysfunction, that's whether it's in your gut lining, your skin barrier, or your respiratory mucosal membranes. Chronic low-grade inflammation that primes the immune system to overreact. Think of allergies and autoimmunity as different flavors of the same underlying immune dysfunction. Once you see it this way, it makes perfect sense why so many people have both. Number 2, Sjogren's often sits at the crossroads of allergy and autoimmunity, and they amplify each other. When I take a detailed history from my patients with Sjogren's, here's what I hear over and over again. I had terrible eczema as a kid. I've always had seasonal allergies. I developed food sensitivities in my 20s. I react to everything, fragrances, chemicals, you name it. These aren't coincidences. These are signs that the immune system has been dysregulated for years, maybe for decades before Sjogren's was diagnosed. And here's the kicker. These conditions don't just coexist, they fuel each other. Your mast cells, the cells which are involved in allergic reactions, can contribute to activating your B cells and your T cells, the cells that are driving autoimmunity. Your chronic autoimmune inflammation can make your mast cells more reactive and trigger happy too. It's a vicious cycle, and breaking that cycle requires understanding that you can't just treat the Sjogren's in isolation. You have to address the whole immune picture. Number 3, Sjogren's is one of the most common but least recognized autoimmune diseases. Sjogren's affects an estimated 4 million Americans. That makes it one of the most common autoimmune diseases, right up there with rheumatoid arthritis and much more common than lupus. But if you ask the average person on the street if they've heard of it, you'll often get a blank stare. Ask many primary care doctors, they'll know the basics at best. And here's what almost nobody recognizes: how often Sjogren's overlaps with allergic and hypersensitivity conditions. The textbooks don't talk about it. The diagnostic criteria don't capture it. But clinically, in real patients, it's everywhere. I see patients who've been told they have chronic allergies, idiopathic urticaria, non-specific immune dysregulation for years before anyone connects it to Sjogren's. This lack of recognition has real consequences. Delays diagnosis, it leads to fragmented care. We're seeing the allergist for one thing, rheumatologist for another, neurologist for a third thing, and no one is able to put these pieces together. We need to do better. Sjogren's deserves to be recognized as the complex, multi-system disease that it is. Number 4, many people with Sjogren's have undiagnosed small fiber neuropathy. Let me ask you, Do you have burning sensations in your hands or your feet, tingling, electric shock feelings, temperature sensitivity where heat or cold feels unbearable on your skin? Or maybe you've noticed that you used to sweat a lot and now you don't sweat at all. Or maybe the reverse is true. Many people with these symptoms have been told it's anxiety, it's fibromyalgia, or it's just part of having a chronic illness. But there's a real, measurable, physiologic explanation many times, which is small fiber neuropathy. This is damage or dysfunction to the tiny nerve fibers in your skin and other parts of your body that sense temperature and pain. We can actually test for this now. Skin biopsies can measure the nerve fiber density. Specialized testing called a QSART can measure how your nerves respond to temperature and vibration. And study after study shows that small fiber neuropathy is common in Sjogren's. Some studies suggest that up to 30 to 40% of patients have it. But why does this matter? There aren't super great treatments, but there are certain interventions that may help. Things like low-dose naltrexone, certain nerve pain medications, and immune modulating therapies that may be warranted. You can't treat what you don't diagnose. So if you have these symptoms, advocating for testing can be really helpful. And I want you to know this isn't in your head, it's in your nerves. Number 5, Sjogren's can start in the gut or the oral microbiome. Here's the thing that often blows people's minds. The majority of your immune system lives in your gut. Your gut lining is the interface between the outside world, the food you eat, the bacteria you're exposed to, and your internal immune system. When your gut microbiome, the community of bacteria and other microbes living in your digestive tract, becomes disrupted, it can trigger immune activation. Same is true for your oral microbiome, the bacterial community in your mouth, because your mouth is part of your digestive tract. Research is increasingly showing that shifts in microbial diversity and changes in mucosal immunity can happen well before the classic symptoms of Sjogren's or other autoimmune conditions appear. Before you notice dryness, your immune system may already be responding to changes in your gut or oral environment. And this is why I ask every patient about their digestive health. You have bloating, irregular bowel movements, food intolerances. These can be clues that gut dysbiosis is part of your Sjogren's picture. And addressing gut health through diet, prebiotics, sometimes specific medications, can actually improve your overall immune regulation. It's not alternative medicine, it's using lifestyle as medicine and understanding that immune health starts with the gut. 6, antihistamines can actually worsen dryness in Sjogren's. This is one of those crucial and cruel ironies that patients with Sjogren's experience. Many patients with Sjogren's may have allergies or other mast cell related issues like mast cell activation. So naturally, you're going to reach for antihistamines. The problem is that antihistamines, especially old school ones like diphenhydramine, aka Benadryl, have what we call anticholinergic effects. They block certain receptors that are involved in gland secretion, including your salivary glands into your glands. So the very medication you're taking for your allergies can actually make your dry mouth or your dry eye worse. It can contribute to difficulty swallowing, increased dental problems, and worsening fatigue. Now, does that mean you should never take antihistamines if you have Sjogren's? Not necessarily. Sometimes the benefits outweigh the risks, but you need to be strategic and you need to work with your personal healthcare team. It's important to use them when they're needed and not to default by using them year-round without that medical guidance. Consider using the non-anticholinergic alternatives when possible. So these are the longer-acting, less sedating antihistamines, things like loratadine, fexofenadine, and cetirizine. You can also try to counteract the drying effects with more aggressive moisture replacement. It's really helpful to work with a knowledgeable physician or another clinician to balance your allergy and autoimmune management. And this is the kind of nuance that often gets missed when your care is fragmented across multiple specialists who unfortunately aren't talking to each other. Number 7, autonomic dysfunction is common in Sjogren's, rarely tested. Your autonomic or automatic nervous system is the part of your nervous system that is running in the background, controlling things like heart rate, blood pressure, digestion, and temperature regulation. Many people with Sjogren's have symptoms of autonomic dysfunction, dizziness or lightheadedness when standing, heart rates that jump dramatically with position changes, temperature regulation problems, changes in their ability to sweat, motility issues that affect digestion, blood pressure fluctuations. Some people with these symptoms get diagnosed with POTS, postural orthostatic tachycardia syndrome, but often nobody connects it back to Sjogren's. Here's the connection. Sjogren's can cause inflammation of the autonomic nerves themselves, or it can cause antibodies that affect autonomic nerve function. This is called autoimmune autonomic neuropathy. We can test for these things with tilt table testing, autonomic reflex screening, or even specialized antibody panels. When we identify it, we can treat it with medications that support autonomic function, physical therapy techniques, and potentially immune modulating treatments. But again, you can't treat what you don't test for. If you have these symptoms, they deserve investigation, not dismissal. Number 8, fatigue in Sjogren's is a metabolic problem, not just an inflammatory one. So let me paint a picture you might recognize. You wake up exhausted, even after a full night's sleep. By afternoon, you feel like you've been hit by a truck. Your muscles feel weak. Your brain is foggy. You may look fine, so people tell you, oh, you're just tired, you're stressed. This isn't normal tiredness. It is profound. It is life-altering fatigue. And for years, we've thought of autoimmune fatigue as purely inflammatory. Your immune system is active, your body's fighting itself, it uses energy, and so that must be why we're so tired. And yes, that is part of it. But newer research is showing that mitochondrial dysfunction, problems with the tiny energy-producing factories inside your cells, plays a major role. Your cells literally can't produce enough energy efficiently. Multiple factors contribute to this. Chronic inflammation can affect the mitochondrial function. Autoantibodies might directly affect energy metabolism. Nutritional deficiencies are common in autoimmune diseases. Those nutrients are needed to create and maintain mitochondrial function. Sleep disruption from pain, dryness, or other symptoms also contributing. And then you can layer on top of that autonomic dysfunction that can affect cellular oxygen delivery and other aspects to this complex physiology. This is why treating inflammation isn't always enough. We need to support our body's energy production through targeted supplementation that might include things like CoQ10, carnitine, B vitamins, optimizing sleep quality and quantity, using strategic movement and pacing strategies, and addressing mitochondrial stressors. Your fatigue is real. It has a biological basis, and those things can be addressed, and we're continuing to learn how we might intervene on those too. All right, we're coming down to the end. Number 9, early treatment can preserve gland function. Here's something that people don't realize. Sjogren's is progressive. Now, the speed at which it progresses does seem to vary from patient to patient. The longer your immune system, though, attacks your moisture-producing glands, the more irreversible damage is thought to accumulate. And once this gland tissue is destroyed and replaced with scar tissue and inflammatory infiltrates, we aren't so sure that we can get it back. Now, there are some really amazing studies that are being undergone in patients, in particular, some at the University of Wisconsin, where they're looking at the role of stem cell treatments for salivary gland function. But goodness, what if we could slow or stop that inflammation before it destroys the glands, so that we may not be dependent on artificial moisture replacement for the rest of our lives? What can we do? So I tend to recommend with my patients a multi-factor approach. Hydroxychloroquine currently is the treatment that we reach for most often as a first-line treatment for Sjogren's. Now, it is not FDA approved for Sjogren's, but it is often used for its approved use in lupus, and we have adopted it within Sjogren's treatment too. It is an immune modulator. It does not necessarily increase your risk of infections or cancer like some other more powerful immune suppressing medications can. Now, the data is not great in regards to hydroxychloroquine on its own improving dryness symptoms, but I think it is helpful to consider as a lower risk intervention, and thinking about it as, a part of the puzzle that we may be assembling for a treatment plan. We also want to think about how we can harness the power of lifestyle to turn down inflammation too. Are there some ways that we can address things through diet, through movement, through stress response, improving sleep to help turn down systemic inflammation as well? And hopefully, as I'm recording this mid-January of 2026, the hope is that in about 6 months, give or take, we will have targeted FDA-approved treatment approved for Sjogren's. And in that early data that was released this past fall, ianalumab did look to show better benefit in those folks who were in the study who were more recently diagnosed, those that were diagnosed within, I believe, about 8 years of enrolling in the study. We'll make sure to record an additional YouTube or video on that in the coming weeks and months. But this is why early diagnosis matters. And it's why recognizing those early signs, the overlap of allergies, gut symptoms, fatigue, body pain, and dryness, and connecting them to Sjogren's is vitally important. We don't want to wait until our mouth is so dry we can't swallow, or our eyes are constantly getting damaged from the dryness. It's really important to advocate for earlier evaluation and proactive management. Number 10, Sjogren's deserves more awareness and better tools. I'm going to be blunt here. Sjogren's is dramatically underrecognized, undertreated, and underfunded. It affects millions of people. It can impact virtually every organ in our body. It significantly impairs quality of life. And yet, it is often treated as a footnote, a minor condition that is not a big deal, or if you had to have an autoimmune condition, you'd only hope that it was Sjogren's. Wrong. We need better biomarkers for early detection and for what we currently term seronegative disease. We need better biomarkers that help us understand whose disease is more aggressive and may need more aggressive intervention. We need more research into the mechanisms driving this disease. We need a recognition of the full spectrum of Sjogren's manifestations, in particular the neurologic manifestations. We really need to see an integration of allergy, immunology, rheumatology, neurology, all coming together to help our patients. We need better patient education and empowerment. Sjogren's is a complex immune spectrum condition that affects the entire body. It sits at the intersection of allergy and autoimmunity. It affects the nervous system, the gut, our metabolism, our autonomic nervous system, not just the moisture-producing glands. And it's time we treat it with the seriousness and sophistication it deserves. So if you've watched this far, I'm guessing that a lot of these things resonated with you. Maybe you've been experiencing symptoms that no one has been able to explain. Maybe you have been told it's all in your head or that it's not related to Sjogren's. I want you to know you are not crazy. Your symptoms are real and they deserve comprehensive, knowledgeable care. This is the exact kind of integrated approach that I bring to my practice at the Immune Confident Institute. I don't just treat Sjogren's as a rheumatology condition or your allergies as separate issues. We really look at the whole picture because we want to understand your story, your lived experience, and what information your body is telling you and telling us. If you're looking for a physician who understands these complex conditions, who has expertise in both allergy and autoimmunity, and who has that personal understanding of the Sjogren's journey, I'd be honored to work with you. You can explore our new patient packages designed specifically for complex immune conditions at the link in the description below. We dig deep, connect the dots, and create a personalized plan that addresses your unique situation. Now, whether or not you're ready or able to work together one-on-one, I want to invite you to our community. We have a free group over on Facebook, Success with Sjogren's. It is a place where hundreds here, thousands now of people who truly understand this journey come together We share our experiences with these exact symptoms we talked about today. We celebrate when someone finally gets the right diagnosis and treatment. We support each other through the frustrating doctor's appointments and those hard flare days. You'll find people who know what it's like to have both allergies and autoimmunity. People who understand the fatigue, the nerve pain, the digestive issues, all of it. The link is in the description, so come find your people. You don't have to figure this out alone. I also want to hear from you. Which of these 10 things surprised you the most? And did any of them finally explain symptoms you've been having? Are there connections that you're seeing now that you've never seen before? Drop your thoughts in the comments below. I do my best to read every single one, and I love having these conversations with you. If this video helped you connect some dots, please share it with someone else who might need to hear this. Sjogren's awareness starts with education, and you sharing this information could literally change someone's diagnostic journey. Don't forget to subscribe, hit the notification bell so you don't miss future videos where we dive deep into these complex immune topics. And until next time, stay curious, stay empowered, and remember that you deserve comprehensive care that sees the whole picture and all of you. I'll see you in the next one.